Hi, so we're here today just to give some tips about putting HRT patches on and getting them to stick well. So the first thing is that when you get your HRT patch that your clinician's prescribed, is just to tear it open rather than cut it so you don't inadvertently cut the patch. If the patches aren't sticking very well, sometimes it can be worth warming the patch between your hands or popping it in your clothes somewhere for a couple of minutes, or actually just using a hairdryer very lightly on it just to warm it slightly. Make sure that the skin that you're putting it on has no moisturising creams or anything like that, and it's nice and clean and dry. Take the back of the patch adhesive part off, and we like you to place it underneath where the tummy button is. So lower abdomen, upper thigh or bottom. I tend to say to my patients not to use the bottom if you use heated car seats in the winter, because sometimes that can just affect the absorption. If your clinician has asked you to cut the patch for any reason to change the dose, we advise that you do that diagonally because it's a matrix patch and it just means that it is also easier to peel the back off and deliver the hormone better. So remove the protective liner of the patch and then apply it, so for example here, and then put your hand over the patch afterwards for about 30 seconds just to warm the patch so that it sticks nicely. Then 3 to 4 days later, when you go to change it, change the site and move to the other side. You might find that you have a little bit of adhesive still left on the skin afterwards, a bit like after you've removed a plaster. And there's easy ways to remove that just with a towel, some baby oil, or if you don't have sensitive skin, a nail varnish remover can be quite helpful as well. Hope that helps. Thanks a lot.